All right, now we're going to talk about pain and inflammation for pharmacology. We're going to start off with opioids. So the opioid antagonist is what? The opioid agonist is morphine. The antagonist is pentacene. The antagonist is naloxone. The non-opioid essentially antagonist is tramadol. No idea what that means, but oh well. Okay, first one's morphine. What's the generic name of morphine? Morphine. What is morphine indicated for? Severe pain and MIs. What are some of the ways that morphine is prepared? PO. Immediate release, extended release, IV, IM, sub-Q, intrathecal. What is the half-life of morphine? 3 hours. What is the therapeutic class of morphine? Strong opioid analgesic. What is the pharmacologic class of morphine? Opioid agonist. What is the Controlled Substance Act of morphine? Schedule 2. And something have additional nursing considerations. Fentanyl patches as Dactera. What are the actions of morphine? Alters perception of pain in your brain, affects the CNS and how you respond to pain. What are the adverse reactions of morphine? You got the classic opioid triad, which is a coma or sedation, respiratory depression, and pinpoint pupils, which is meiosis. You can also have urinary retention, biliary, colic, emesis, OH, cough suppression, euphoria, and mental clouding. What is the antidote for morphine? Naloxone. So, morphine has a first big pass effect. What does that mean? So, your IV dose is going to be lower than your PO dose. So, vital signs wise, what 2 vitals would you monitor with morphine? Pulse ox and blood pressure. So, what are you going to consider when someone's taking morphine? Don't take any CNS depressants, don't take any kavas, and don't operate heavy machinery. All right, pentacene, I think. How do I say this name? Got to find out her.
Pentacene.
Pentacene. Oh my god, pentacene. All right, what is pentacene used for? Mild to moderate pain, manage abstinence syndrome. How is pentacene prepared? IV, IM, sub-Q, which can be reversed by Narcan. PO is combination with naloxone. What is the therapeutic class of pentacene?
Pentacene.
Opioid analgesic. What is the pharmacologic class of
pentacene?
Opioid partial agonist antagonist. What is the Controlled Substances Act of
pentacene?
Schedule 4. What are the actions of
pentacene?
Binds to opiate receptors in the CNS and alters the perception of pain in the brain. So with the opioid, you want to take off opiate first. What are the adverse reactions of
pentacene?
Kind of like morphine, minimal CNS depression, little to no euphoria, psychomimetic effects. So what types of patients do you have to be cautious with when taking pentacene? Heart failure, COPD, and heart attack people. Now we're going to go over patient-controlled analgesia. It's used for pain control after procedures, palliative care, and trauma. Be careful with sedation. Patients can control it only. Ketamine is used to sedate horses. Educate to not OD if they're sleeping. They're not in a lot of pain. Well, it's not. Okay. All right. Naloxone or Narcan. What is it used for? Opioid overdose, reversal of respiratory and CNS depression caused by overdose with opioid agonists. What are the actions of naloxone? Antagonist at the same receptor sites at opioids, does not produce analgesia or any of the other effects caused by opioid agonists. How is naloxone prepared? IV, IM, sub-Q, nasal, 0.4 megs with a half-life of 2 hours. What is the therapeutic class of naloxone? Opioid analgesic. What is the pharmacologic class of naloxone? Opioid antagonist, pure. What are some of the adverse reactions of naloxone? B, abstinence syndrome. So violent sneezing, weakness, nausea, vomiting, diarrhea, abdominal cramps, bone and muscle pain, muscle spasms, kicking movements. So why do we have to be ready to fight when using naloxone? Naloxone wears off in about an hour, and the opioids last longer than that, so you're going to have to get ready. So it's titrate based on sedation level. What's our primary concern with naloxone? A sedative effect. So if they have the decreased LOC, blood pressure, oxygen, respiratory rate, Narcan's not working. What about pregnancy with naloxone? If pregnant women that are on opioids have pregnant, they give birth to babies. The babies become addicted, so they'll give the babies naloxone as well. All right, Tramadol. What is Tramadol used for? Moderate to moderately severe pain. What are the actions of Tramadol? Combination of opioid and non-opioid mechanisms, weak agonist activity, mu receptors, blocks uptake of norepinephrine and serotonin, activates monoaminergic spinal inhibition of pain. How is Tramadol prepared? PO, immediate or extended release. What is the therapeutic class of Tramadol? Non-opioid, centrally acting analgesic. What is the controlled substance act of Tramadol? Schedule 4. What are the adverse reactions of Tramadol? Sedation, dizziness, headache, dry mouth, constipation. However, these are rare. And then drug. Concomitant CNS depressants, increased effects. And MAOIs, hypertensive crisis. What are the nursing considerations of Tramadols? Can be vehicle for suicide and can cause respiratory and CNS depression. So don't give to suicide patients. What is the antidote for Tramadol? Tyramine. All right, now we're going to go over more drugs. What is a COX-1 inhibitor? Or what is COX-1? Prostaglandins that promote platelet aggregation and protect the stomach and intestinal lining. What is COX-2? Produced at site of tissue inflammation, such as inflammation and other places. All right, what is aspirin used for? inflammation, pain, MI, stroke, and fever. How is aspirin prepared? PO or PR. What is the therapeutic class of aspirin? Non-narcotic, analgesic, antipyretic, anti-inflammatory, antiplatelet. What is the action of aspirin? Inactivates COS1. What are the adverse reactions of aspirin? Rise syndrome in children is a viral illness with a fever, heartburn, nausea, renal impairment, pregnancy D category. What are the nursing considerations of aspirin? Bleeding, renal upset, and GI upset. What are we going to monitor in platelets taking aspirin? Vomiting blood, BUN, creatinine, blood and stool, platelets, low BP, tachycardia, increased respirations, H&H. And children should not be given it unless under the direction of a physician because Pepto-Bismol has aspirin. If you didn't know that. All right. Ibuprofen, aka Advil or Motrin. What is ibuprofen used for? RA and arthritis. How is ibuprofen prepared? PO. What is the therapeutic class of ibuprofen? Non-aspirin, first generation NSAID. What is the action of ibuprofen? Inhibit COX-1 and COX-2, have all analgesic, antipyretic, and anti-inflammatory properties. What are the adverse reactions of ibuprofen? Stevens-Johnson syndrome, rare. And what are the nursing considerations of ibuprofen? MI, stroke, or bleeding. And what are you going to take ibuprofen with? PPI, protein pump inhibitor. What is celecoxib used for? Osteoarthritis, RA, and pain. How is celecoxib prepared? PO. What is the therapeutic class of celecoxib? Non-aspirin, second generation NSAID, COX-2 inhibitor. What is the action of celecoxib? Prevents the synthesis of a chemical called prostaglandin by inhibiting an enzyme called COX-2. What are the adverse reactions of celecoxib? Ulcerations, CV effects, renal impairments, sulfa allergy. What are the nursing considerations of celecoxib? Bleeding, allergies, cardiovascular, and renal. What are you going to take celecoxib with? PPI, safer on GI. What medicine would celecoxib might increase the anticoagulant effects of? Warfarin, PTI and I, boy. Alright. Glucocorticoids. Here we go. Let's do it. Alright. Dexamethasone is our glucocorticoid and prednisone are glucocorticoids. Alright. Alright, what do we use glucocorticoids for? Non-endocrine disorders, RA, SLA, SLE, COPD, asthma, neoplasms. How do we prepare glucocorticoids? PO, IM, IV, sub-Q, topically, inhale, IH, injection. What is the action of glucocorticoids? Decrease inflammatory response in the body. What are the adverse reactions of glucocorticoids? Adrenal insufficiency, osteoporosis, infection, glucose intolerance, F&E disturbance, growth delay, peptic ulcer disease, Cushing-Owen symptoms. What are our nursing priorities with glucocorticoids? Check for blood stools, glucose levels, H&H, F&E, watch for coffee ground impetus, and immunosuppression. So you're going to wash hand, get the vaccines, boys. Can read over this, please, 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 please read this. Know this. Get her down. And this too, please, 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 please. Get this down. Either abrupt withdrawal. This is like a long term. Please, please read it. And this too, please, please, please read that. Chat. What is methotrexate used for? RA and cancer. How do we prepare methotrexate? PO. What is the therapeutic class of methotrexate? Antineoplastic. What is the pharmacologic class of methotrexate? Antimetabolite. What do we use? What is the action of methotrexate? For RA, it has an anti-inflammatory action and suppresses the immune system. What are the adverse reactions of methotrexate? Hemorrhagic enteritis, GI perforation, respiratory problems. What are the nursing considerations of methotrexate? Bleeding, breathing, immune system, liver and kidney function test, pregnancy category X, give folic acid to help prevent complications. Read stuff on here. Please. What do we use allopurinol for? Gout, hyperuricemia. How do we prepare allopurinol? PO or IV. What is the therapeutic class of allopurinol? Anti-gout. What is the pharmacologic class of allopurinol? Xanthine oxidase inhibitors. What is the action of allopurinol? Decrease uric acid levels in the blood. Less than 6 in females, less than 7 in males. What are the adverse reactions of allopurinol? Hypersensitivity syndrome, like rash, fever, eosinophilia, and dysfunction of the liver and kidneys. GI upset long term, greater than 3 years, can cause cataracts. Take this with 64 ounces of water, all right? Because you can get kidney stones from it, and take with food, all right? Allopurinol. Other meds for gout and RA are going to be glucocorticoids and NSAIDs. All right, cool. Key takeaways. Boom, boom. Have a great day.